All right, today we're going to look at how to do synchronized cardioversion, or also it's commonly called electrical cardioversion. This is applied to your algorithm that is adult tachyarrhythmias with a pulse. So if your patient has a tachycardia and they still have a pulse, then this is one of the items that you'll be completing. So you identify your patient has a high heart rate, greater than 150. You call your rapid response team, establish your roles, and then you want to make sure your AED pads are placed on the patient. Once the AED pads are placed on the patient, you'll turn your defibrillator on. Okay. And you'll be able to see the heart rate, the SpO2 monitoring, and then your blood pressure cuff. And of course, that's if you have your pulse ox and your blood pressure cuff attached to your defibrillator. But looking at the heart rate, you're able to see that it is consistently above 150. Also, you can see based on this rhythm that it looks like it's atrial fibrillation. Um, and of course, with a very fast rate. So, this patient is definitely indicative of needing electrical cardioversion. Whenever we do that, we want to make sure that we can have all of our equipment at the bedside. So bring in the crash cart that includes any suction, IV access is established, any airway equipment if needed. And then it's recommended to also give sedation to your patient if possible and if it's appropriate. So now that we have established our team and are ready, we want to make sure to hit the sync button. And so in that first column, you can see sync. I'm going to go ahead and click that. It's now green, and you'll notice that these little green arrows populate above your QRS wave. This indicates that it's identifying where the QRSs are so that it can be able to sync and cardiovert. Next, you want to establish your joules. The electrical cardioversion algorithm indicates how many joules is recommended depending on what kind of rhythm is being displayed. So since this is atrial fibrillation, the recommended joules is 200. So on the right column, the second column on buttons, we're going to hit energy select, and we're going to make sure that we get it to that recommended joules. So I'm going to go ahead and click the up arrow to 200 joules. So I've established my joules. I've established my QRSs are being documented and consistently found. And now it's time to charge and then administer the shock. So I'm going to hit charge. I'm going to make sure to say clear and look around and visually see if my team is clear from the bed. Once they're clear, I'm going to hit the shock button. All right. And whenever I hit the shock button, you can see on the QRS or on the EKG rhythm where it had given that shock. The first thing you want to do is, of course, assess the patient and assess what is seen on the monitor. At this time, yes, the patient still has tachycardia, but the atrial fibrillation has been converted into a normal sinus rhythm.